Hey guys, welcome to Skin Sense here on SSP TV. Thank you for watching us on cable and also on our YouTube channel, SSP TV. We're here with Dr. Schleicher today. We're going to talk about some case studies. You will be able to qualify for these case studies based on the specifics that we give you. If you qualify the way that the case studies work, then you can get free, skincare.
You get free skincare or medication,
Right.
plus you get paid for using.
Right. So we're going to talk that in a little bit. But how are you doing, first of all?
I think I'm doing okay.
Yeah, it's the holiday
We're back
season.
on Skin Sense, and you know, it would be without me. It'd be nonsense.
It'd be fun.
I just thought of that. But anyway.
That's hilarious. It would be nonsense.
Yeah.
Okay. It would,
So,
it'd be
but now we're Skin
nonsense.
Sense, so that's a good thing. All right, I showed up. So
Yeah.
wonderful.
You're ready for the holiday. It's good. The weather's getting colder. People are probably coming in with different issues with their skin. I know mine is already dry and itchy, scaly from wearing socks and pants all the time. Your body doesn't
Right, which
see
is
as
a good
much
point because
sun.
you know our skin reacts differently to different temperatures and times a year. And one of the subjects we're going to talk about, actually two subjects we're going to talk about, weather and temperature and humidity play a role. So
All right, so these case studies, first of all, how does a drug become, go on the market? Is it through this, how do you get to the case studies? Because not
Right,
every
it's
drug that
not-
you produce is
exactly.
going to be on the market.
It's not something magical,
Yeah.
okay? It takes millions of dollars to get a drug to the market. And how does that happen? Well, drugs have to be tested. And many times they're tested in the laboratory first. So we're talking mice, or we're talking, let's say you have an antibiotic. How do you know it's going to work? Well, you test it on germs. So that's before you even go to humans.
Okay.
So that's a big thing. And then once you go through the lab testing, then you can do human testing. Okay, and there are different phases of human testing. Not to get too complex, but in the beginning, we're looking for things like safety of a drug and does it work. Okay, and the federal government is very, very concerned about both of those. So there are limited testing done on limited subjects. Many times they don't have diseases, they're just normal people. But we want to know how the drug reacts with normal people. So that's called a phase 1 study. And then you can go all the way up to a phase 4 study, which have more people and mainly people with that certain condition.
Okay, so the federal government's guidelines, are they extremely strict?
Well, they want to protect the consumer. So yeah, they are strict, okay? And they monitor all the testing, okay? Everything has to be approved by the FDA, which is, they're the ones who ultimately approve a drug, okay? So what does that mean? Well, you have to adhere to standards, okay? And the standards are pretty high, which is good for all of us, okay? Because God forbid we have a drug on the market that shouldn't be there. And the FDA does everything they can to try to prevent that.
All right, so will we be comparing apples to apples if we talked about the COVID vaccine? Yes?
Right.
No.
Well, the COVID vaccines are different.
Okay.
Okay, and the COVID vaccine was very different because that had to be almost rushed to the market because we're talking, 1 million people died from COVID. So somebody had to do something very quickly. But most drugs some drugs can take 7 years to get to the market,
Right.
8 years.
And I think
Okay.
that's, and not to get political, but I think that was the concern of some people who aren't in the health industry, or maybe the overload of information, or I should say misinformation on, on all these platforms of news is, are we seeing those side effects, not to get off subject too much, but are we seeing side effects from, the COVID?
Right, and some of the concerns are very valid,
Yeah.
because we had to get the vaccine out very quickly to save lives. And in a sense, you're taking a chance because it hasn't been tested on, vigorously like many, many drugs are. But we had, the government had no choice. And we had people dying left and right. We all lived through COVID. So thank God none of us, we don't have to have masks on, the vast majority of us. But who knows if it's going to come back? We don't know.
Okay, so the drugs that come onto the market, what do you think the percentage of drugs that are tested actually go onto the market? Is it a small?
Right. Well, it's a small percentage because a lot of them don't even make it to the testing phase. And because it costs millions of dollars to market a drug, well, drug companies aren't stupid. They're not going to pick a drug and say, well, we'll take a chance on it. It's not going to happen. Okay, but there are certain rare indications, like there's some very rare diseases that the government will kind of push through therapies because these poor people are suffering and there's not enough people with that disease to check it on. But that's an exception. Most drugs go through years and years of study.
When it comes to dermatology and the drugs that are on the market for them, is that something that is easily an easier process or no?
Well, sometimes you would think so, right?
Yeah.
Because you think of an acne medicine, that's a cream, okay, and that's a little bit easier. But now we're dealing with injectables. Okay, we have conditions such as psoriasis and eczema, which we'll talk about, where we can get great control with the conditions, but they require injections. And anytime you require injections, yeah, it's going to be a lot more stringent as far as testing and oversight.
And so the case studies that they do they decide how many people per case study based on what stage they're at?
Well, again, in the beginning stages, you have limited number of healthy people checking the
After
drug.
the rats.
Right, but then afterwards, then you're going to target people with the condition.
Okay.
Okay, for instance, we did an acne study where we may have 30, 40, 50 patients, but they all have acne. Some of them may not get the actual drug, what's called the placebo. Okay, so we don't know, and patients don't know if you're getting the actual drug or like a copy of the drug but doesn't have the active ingredient.
Okay, so again, we're talking about case studies here on Skin Sense at DermDox with Dr. Schleicher. When we come back, we will talk about 2 case studies. If you have one of these skin conditions, hey, you might get paid to actually use one of these medications. So stay with us right here on SSP TV. Welcome back, everyone, to SSP TV. You are watching Skin Sense here, and we're talking about these case studies. The first one we're going to talk about is rosacea. So we've talked about this before on the show, but explain first of all, Doc, what rosacea is.
Right, and rosacea, I mean, some people you look at and you see redness, okay? Sometimes you look at people and you see redness and pimples.
Right.
And that's probably the best way to explain rosacea. It usually affects people 30s, 40s on. Okay.
But you could have a mild case of rosacea or a severe case of rosacea.
You can have mild or severe, right? And the more severe it is, basically the redder you are or the more pimples that you have.
I know for me, I have a minor case of rosacea, and without makeup, my cheeks look rosy, but certain things affect it. The heat, red wine, those 2 things especially.
No, that's a great observation.
Yeah.
And you're right, spicy foods can do it. Alcohol can do it, so we have to cut you down from your drinking.
Darn it.
We'll talk about that separately.
That's a different show.
But send me over your drinks, all right? I don't have rosacea, so I can handle them. But yeah, and temperature changes can affect rosacea.
Right.
And why does that happen? Well, the main reason why it happens is part of the problem with rosacea, your blood vessels are kind of like almost hyperactive. And those things we talked about actually get the blood vessels to open up, or we call dilate. And some people get flushed, and if you get flushed, it goes away. But with rosacea, it doesn't really go away. People associate alcohol with rosacea, but most people have rosacea, have nothing to do with alcohol.
Right.
Okay, it's just the way you are.
Right.
And it's your complexion.
So what's this case study? Let's see.
And the more fair skin you are, the greater the chance that you'll have rosacea.
Right. Oh, really? Because I don't have fair skin. But okay, so if you have rosacea, and you have rosacea, it needs to be moderate to severe.
Well, we're doing a study now. Okay, we've done several rosacea studies.
Okay.
Some just have to do with the redness. The one we're doing now has to do with the pimples.
Oh, okay.
So, and you have to have X amount of pimples to qualify for the study.
Count your pimples, please.
So count your pimples. If, we're talking, whatever, 15 pimples. They don't have to be big pimples.
Yeah.
They can be any size pimples.
Okay.
But, if you have 7 on one side of the face, 8 on the other side of the face. Because rosacea, really, we're talking about the cheeks and the nose, okay? It doesn't really affect the forehead, doesn't really affect the chin.
Okay.
So, but if you do have rosacea with pimples, you probably would qualify for this study. And what does that mean? It means you take a certain antibiotic, or you might take a placebo, which looks like an antibiotic, but really isn't. And then over the next few weeks, we see how well it helps, because one of the traditional treatments for rosacea is a pill, common antibiotic. So we're testing a pill to see how well it works for rosacea. And it's very easy, because when you come in, basically what we do, we ask you how you're doing, and then we count the number of pimples. And obviously, if you start off with, say, 15 pimples, and 6 weeks later you're down to 6 pimples, well, chances are good that the medicine you're taking works. And the other good thing is, too, not only do you get the medicine for free, but you're paid. Okay, you're paid several $100s for this, few weeks study.
How much time does this take if someone is maybe interested in taking part in the study?
How much time does it take?
On them, so they have
Oh,
to
it doesn't take much time at all.
Is it once a week?
No, it really depends on the study per se, but generally, if it's a very short study, you'll come in every 2 weeks, every 4 weeks. The studies usually last like 3 months that you take the medicine. And then sometimes we see you back afterwards just to see how you're doing. But the medicines for rosacea, they're common. It's nothing out of the ordinary that we're doing.
You sign papers, there might be some side effects like any medication.
Right, we go over things like consent. So we go over, before you can start on the medicine, yeah, of course we have to tell you all about what the study entails. Okay, so we go through all that.
Okay, and then it says here everything is included, all exams, medications, study procedures at no charge to the patient. And then it talks about, that you do get, and you could go over the specifics, several $100s for participating fully in the study.
Which is great. And one thing to point out with studies is, unfortunately today, some people just can't afford medicines.
It's terrible.
It's terrible, for everybody.
Yes,
And
everybody.
Some people, it's more terrible than others. So the good thing about these studies are you get the medicine for free, you get paid for it, and then if it works, then many times we can finagle you to get something similar that would, continue to help your condition until the drug is approved.
So this drug that people in the case study, again, we're looking for those of you who have rosacea. There's criteria, but if you have rosacea, call the office. You might qualify for this case study. If it's in this phase, it means that it's gone through. This is like the final phase.
This is kind of like the final phase, yes.
Okay.
When we're starting to test people at this stage, yes. So it's really, at this stage, of course we want to know how safe it is. But with this particular medicine, we know it's kind of safe. This is what's called like an equivalency study, where a company is coming out with something that's already on the market, but the government makes them, make sure that it's the exact same medicine. But the medicine is already approved. It's out there. It's just being made by another company.
So if you think you're a candidate, what do they have to do? Just
Absolutely.
call the office?
Yeah, we'll put Dana's phone number there. You can call. Dana is the woman who actually coordinates the study, and that's what she does. That's her field of expertise. So you're going to call her. She'll set up a time, and then she'll go over consents with the patient. I'll go over consents, or Zach, our PA. Will go over consent, and yeah, that's how it's handled.
Now, not many, there's not a lot of dermatologists who do case studies, correct, throughout the country?
That's true. Most doctors in general don't do studies. We just happen to specialize. We have a whole, as you know, in the back of our office, we have a whole different office set up just to do clinical studies, and we're opening up a new clinical testing center in the Harrisburg area in Camp Hill.
Can't wait to get there.
So yeah, that'll be kind of cool too.
That'll be fun. Okay, so that's the case study on rosacea. Again, the numbers are on your screen. When we come back, another case study that you can get paid to participate with. And what's that case study going to be on?
That's going to be on eczema.
Okay, eczema. Gosh, eczema too. And ages. We need to talk about ages. When we come back, you're watching Skin Sense here on SSP TV. Welcome back, everyone, to Skin Sense here on SSP TV. You can watch us on local cable and on YouTube at SSP TV. We're here with Dr. Schleicher at DermDox talking about these case studies. If you're a candidate for rosacea, that was the beginning of our show, you can call and get the specifics on that study. The next study we're going to talk about is eczema, and a lot of people might have these skin conditions, but there are specific criteria that you have to meet to actually be a part of the study.
Right. Did you say you had eczema?
Yeah.
Okay, so you qualify for 2 studies.
How about it?
I don't know about
I'm
men.
a case
I don't know
study
about
itself.
mentally might be different though. I don't know if we have a little mental acuity
That's a
test
different-
that goes
that's a
along
different
with it,
study.
but that just shows you how common these conditions
They are.
right? I mean, they're very common.
Right.
I mean, eczema affects a good percentage of the U.S. population.
How could you not have eczema living in northeastern Pennsylvania?
Yeah, I mean, you're talking maybe 7% of the population, perhaps more, with
Oh,
some
geez.
form of eczema,
Yes.
and 340 million people. It's a lot of people out
Yeah.
there.
Yeah.
So
What is eczema, first of all?
Right. Eczema is basically itchy skin.
Yeah.
Okay. We call it the itch that rashes. All right. So you start scratching and then you develop a rash. And many times you have a family history of eczema. So other people in your family will have either eczema, believe it or not, hay fever, and asthma are related to eczema.
Why?
So they all have to do with the immune system.
Okay.
Okay, and eczema is a disorder of the immune system. Now, it can be made worse by other factors. Okay, we're talking, some people are sensitive to dust, and that can make it worse.
Detergent?
Detergents can make it worse.
Cotton or
harsh,
different material?
anything harsh, like even wool clothing can be very, very
Right.
itchy if you're sensitive to it. And of course, temperature. You know, we all know that eczema gets worse in the winter. Why? Because it's cold out and you're
Darn
drying
winter.
out. Yeah, we need to move to Florida, I guess, but that's after the Powerball. But anyway, so there are all different types of eczema. So we'll show you an example of a mild case of eczema, show an example of a severe case of eczema, and an example in between, moderate case of eczema. So there's all different forms. And we're doing studies now on not only different forms, but different types of treatment. So some of the studies deal with a cream that's going to be applied, okay, once or twice a day. And some of the studies deal with actual injectables. Now, we had a revolution in the field of treatment of eczema several years ago. And everybody's seen the commercials, Dupixent, okay, which has been a miracle drug. And that changed our whole thinking about how we can treat people with this disease.
See how those TV commercials work?
Those TV commercials work, and the drug works.
How about
the
it?
drug's really nice, but not everybody responds to the drug, and not everybody can take the drug. Okay, some people with Dupixent develop what's called redness of their eyes. Okay, so it's not for everyone. But more recently, you've seen the commercials, we have what's called JAK inhibitors, okay, Cymbico, Rinvoq, okay, you've all seen the commercials, and that's another way of approaching eczema.
Do you decide for the case study if they get the injectable or the
Very
pill?
good point, and a lot of it depends on what type of eczema they have. Okay, so if you're very, very mild eczema, you're not going to get an injectable, you're going to get basically a cream. If you're very severe, well, we see people, their whole bodies, I showed you a picture of somebody with eczema, and it's, this poor guy's had eczema all his life.
So is it true, like if it's scale where you could actually pick it, you shouldn't pick it off, correct?
Well, the more you rub and pick at eczema, the harder it is to treat, because your skin will get thicker. Okay, and where does eczema, the common sites for eczema? Right here.
Creases.
And behind that's very, very common areas for eczema.
Around the ankles,
So-
no?
Well, you can get anywhere, okay? But the common areas are behind your knees and behind your elbows. But no, there are people, you can have eczema, that's severe eczema. Now, some people can have just moderate skin findings with it, but they itch. Okay, and those poor people, you know, it's very, very tough to control because, you know, you can almost clear their skin up, but they still continue to itch. And we're doing another study for people who have eczema. It can be very, very mild, but there's a pill that they're looking at to see if it will help relieve the itching.
So who watching qualifies if they have eczema for the case study?
Well, again, it depends on what type you have. And that's what you want to speak to our clinical research associate with, because we will decide, you know, in conjunction of her, which is the best study for you. And some depends on age groups, okay, whether you're 12 and above, that may play a role because, you know, we're not going to be going injecting, you know, lots of kids, but we'd certainly be using creams on kids, okay? And by and large, many of these studies are 18 years and above for many of them, but some, you know, you want to get kids in. And we want to get different ethnicities. The FDA is very, very concerned about studies that don't include Hispanics, don't include blacks. It's hard to recruit. I mean, we live in an area where we have a good population of Hispanics. We don't have many blacks. So we're looking at big cities to recruit blacks. It's very, very important because surprisingly, blacks sometimes respond differently to medications than Caucasians.
Who's more prone to get eczema? Is it?
That's a real good question. Yeah, eczema can be seen with virtually any ethnicity.
Okay.
Yeah.
Because I know some of the skin conditions, it's primarily, you know, it can be a different
Right. No, you're absolutely right.
nationality.
And for instance, blacks are more prone to get what's called keloids, which is exaggerated scar conditions. So there are, and they have different hair problems because they have different hair,
How their hair grows out.
Yeah. Yeah, so there are differences. And there are differences with certain medications. And how are we going to know unless we get a big enough black population?
How many weeks is the study, or how much commitment?
It depends. So one of the studies, for instance, the longest study, you're basically followed for 7 weeks or so.
Okay.
And I believe you're paid over $1,000 if you complete the study. And I think you're paid for transportation costs too.
And you get the medication.
And you get the medication. And there's so many people out there who are suffering with eczema, because you're talking millions and millions of Americans who have it. And a lot of people either don't have health insurance, don't know where to turn.
Don't even know what kind of skin condition they have.
That's true.
So they can call here and get an appointment
Yeah,
for that.
yeah, at least get checked out,
Yes.
because we can tell you at least what skin condition you have.
Good point. All right, the number's on your screen for the case studies to see if you qualify. Call the number, talk with Dana, get all the information ahead of time, and then you could be a part of something that turns into a drug that's on the market.
It's very exciting. And, you know, we have many patients who say, you know, come back and say, hey, you know, I'm one of the reasons why this drug is on the market.
That's cool.
So it's very, 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 very cool.
All right, Doc, nice seeing you again.
Yes, and I'll see you soon.
Yes, and thank you for watching us here on Skin Sense on SSP TV. We'll see you next time.